Welcome to the Wave 2024 Recap Show. I'm Caitlin Carmoot, bringing you the latest updates from today's Wave events. Artificial intelligence is the buzz these days, not only in the tech world, but also the healthcare industry. How can we leverage AI to improve documentation and also enhance providers' understandings of their patients?
And in many ways, the AI revolution is being powered by the new availability of web-scale data sets that are being used to train machine learning models atop of high-end computing clusters.
Our Chief Innovation Officer, Brandon Martinez, talked about this during his keynote address this morning. What's the importance of not just gathering data, but leveraging algorithms to quickly put this data into the healthcare provider's hands? AI remained a central theme throughout the day, with numerous discussions exploring its potential. During a panel discussion, Brandon Martinez and Sam Brown discussed strategies for practical implementations and the affordability of these innovations for healthcare agencies. So what does this mean practically, and how can AI-driven systems process healthcare narratives instantly? We'll go to Pat Piper in the Product Pavilion to see where we could go.
Thanks, Caitlin. We are here in the Product Pavilion. Theme for today has been AI, as many of you heard this morning in our general session. Lots of uses. Really excited for where this is going to go, how we're going to be able to use it. One of the uses that we saw that we'd like to take a look at now is in a generated narrative. So AI can take the data in the application and generate a narrative, right, Clay? And it's going to be a fantastic benefit for our users. It's something that our users have asked for several years. They've really been asking product for this, for us, for ESO to create this feature to have auto-generated narratives. And some of the benefits as we think through it, right, from a field perspective, having the data that's in the application, AI can take the important pieces of that and populate it into the narrative. So it saves time for the user. Creates a consistent narrative, right, with the consistent data. So when we think about the continuation of patient care, the clinicians that see those reports know where to look for the information. They get the same information, reliable information, and it stays consistent. So that's big for us. Data integrity, right? It's always been a really big, important thing for us with ESO. So Clay, would you take a second and show us how we would use that in our new iOS?
And once I've really kind of added a bunch of data into my chart, now I can go to that narrative section and kind of showcase that AI can build that narrative for me based of all the kind of the aggregation of data we've already put in the chart. And so what you see is it's going to give you an HPI or history of present illness, also your assessment findings down here, and then it's also going to have your treatments as well. And it's in a nice kind of clear format, easy to read, and you can also edit it. So
thanks, Clay. I'm super excited about that too. I agree. Great use of AI. Can't wait to see what else is coming. That's it here from the Product Pavilion. Back to you, Caitlin.
Thank you, Pat. Today was also marked by thought leadership and industry-changing practices, like how the St. Louis Fire Department works to mitigate mental health and substance use by leaning on their partner organizations like CREW, a crisis response unit focused on behavioral health emergencies. Now, the St. Louis Fire Department was able to decrease its calls for behavioral health crises by 44%, and for substance use disorders by 54% in just 1 year. And now we'll head over to our acquired Interdev Canadian customers. They've learned how to incorporate mobile integrated healthcare and their Providence. Crews there have been able to push callers to its referred mental health agencies by 80% versus going to the ER. They've also seen a 75% reduction in ambulance response to mental health calls and a 10% reduction in hospital admissions for mental health and addiction.
It is probably, like I said, is the most meaningful work that I have done as a paramedic of 32 years. To really be able to meet people where they're at and develop that relationship with individuals and really see a transformation within their life.
Having a solution that can provide care in where they live and where we meet them where they're at, that data tells us the types of conditions that are out there that can be better served elsewhere, where they're at in the community, and understanding what are the other factors. So we turn to other partners to understand their data as well, whether it's social deprivation data or public health related data.
Now, programs like these complement the services provided by healthcare systems, ensuring continuity of care while also easing the strain on resources. And finally, to a fire panel discussion on lithium-ion batteries, fire construction, and wildfire impacts. We heard from several leaders from the fire service. The key theme there, data-rich and information-poor. What does that mean? Well, in other words, how do firefighters validate the data they're putting in?
Sometimes we have too much data that we don't know what to do with it.
Speaking of data, if you want to learn more about fire trends impacting the fire industry, you can check out our annual Fire Index. This year, we introduced the Outdoor Fire Measure, which revealed that the threat of wildland and outdoor fires is escalating. To give you an example, unauthorized burning made up 31% of fire-related incidents in 2023. Thanks for watching. That's day 3. We'll see you here tomorrow.